How to prepare your body for pregnancy. So, you're ready to get pregnant. Congratulations! Making the decision to try for a baby is a huge milestone in life. If you know you want to try to conceive, there is no better time to start preparing your body and mind. In a perfect world, we would all prioritize our physical and mental health all the time. But in a busy, sometimes stressful world, it's not usual to put our individual health on the back burner. If someone is really preparing their body and mind for pregnancy, ideally, they should start as much as a year or 6 months before. But in reality, even 3 months or 90 days of preparation goes a long way. Yes, you heard correctly. Welcome to my channel, Mama's World, all about mother and baby care. In today's video, I will be discussing how to prepare your body for pregnancy in detail. So stay tuned until the end of the video. And if you're new to my channel, don't forget to subscribe and hit the bell icon. What should you do or not do if you're trying to get pregnant? Here's a list of what you can do to prepare yourself for conception. Stop birth control. The first thing you should do to have a pregnancy is to stop using precautions. If you want to conceive, you'll need to discontinue any form or forms of birth control you're using. You can be pregnant within days of stopping your birth control. So do not do it until you're good and ready. There is a common misconception that you should be off birth control before trying to get pregnant, so you get your cycle back. But in reality, unless your birth control is making an underlying ovulation disorder, many people can achieve pregnancy relatively quickly after going off contraceptives. Start a multivitamin. Pregnancy is taxing on the body's nutritional stores. Give yourself a boost by taking a multivitamin to bridge any gaps. Better yet, prenatal vitamins are specifically formulated to give your body what it needs during pregnancy. Starting a prenatal now will help you avoid any nutritional deficiencies during early pregnancy. The best time to get in the habit of taking a prenatal vitamin is before you are pregnant. You'll also have time to try out a few brands to see what works best for your body. Add folic acid. In addition to your prenatal vitamin, you may need an extra folic acid or folate supplement to prevent neural tube defects during early pregnancy. Be sure you're taking at least 400 to 800 micrograms of trusted source of folic acid per day. Many over-the-counter prenatal vitamins already contain this amount, but be sure to check the label. Eat well. You can also get many of the vitamins and minerals you need from eating a healthy, balanced diet. Enjoy whole foods over anything processed. You may also want to incorporate more organic fruits and vegetables into your diet to limit your exposure to toxins. There is also a variety of foods you shouldn't eat when you're pregnant. If you're currently consuming a lot of them, you may want to try to cut them out before you get pregnant, just to make things easier on yourself when the time comes. Exercise. Moving your body at least 4 to 5 times a week is another great way to prepare for pregnancy. Aim to get at least 30 minutes of moderate activity for a total of 150 minutes each week. Starting from the couch, just pick something light, like walking, that you can do right outside of your front door. Start with just 10 to 15 minutes at a time and work your way up to longer durations. Doctors recommend 30 minutes of exercise a day at least 5 times a week. Exercise improves cardiovascular health, helps with weight management, and relieves stress. All are positive in general, but especially when you're trying to get pregnant. Check vaccinations. Your physical appointment is also a great opportunity to get caught up on any vaccinations that may have lapsed, like tetanus, rubella, etc. Vaccinations can help keep both you and your baby healthy and protected. Do regular checkups and complete all your vaccination courses on time to avoid any complications. Schedule a preconception visit. Depending on a number of factors, such as age, previous fertility issues, etc., you may also want to schedule a special preconception visit with your obstetrician. Some of the areas of this examination may overlap with your physical, so be sure to bring any specific reproductive questions you may have. Your visit should cover anything you're concerned about, from screening for sexually transmitted diseases to screening for pregnancy readiness. Track your cycle. Whether you've been on birth control or not, now is the time to get intimate with your menstrual cycle. Narrowing down the window of when you're most fertile will help you get pregnant faster. Plus, Having an understanding of your cycle will help you discover if anything is off and might need addressing, like spotting, irregular lengths, etc. Start by simply recording when your period starts and ends to see how the length of your cycle changes from month to month. You can note anything like irregular bleeding and spotting too. The average menstrual cycle length is around 28 days, but it can range from 21 to 35 days and still fall in the normal, healthy range. There are many apps out there to help you with tracking as well. Limit toxin exposure. High amounts of toxic exposure can be dangerous for a developing baby. Try to lower your exposure to common offenders by avoiding synthetic fragrances, going bisphenol A BPA-free, choosing a chemical-free home and personal care products, skipping certain beauty services. Here are other few things you can start doing today. Make your own household cleaners using water and vinegar, eat organic foods, stock up on fragrance-free laundry detergents, toss makeup products that contain parabens, sodium lauryl sulfate, and mercury, choose fresh foods over canned, which may contain BPA. To have a healthy pregnancy and baby, limit toxic exposure as much as possible. After all, the coming little one is your whole world, isn't it so? Practice stress relief. Stress reduction isn't directly correlated to improving rates of pregnancy, but there is a lot of value in it that can impact your overall well-being, which can affect your fertility. Reducing stress can help you think more clearly, make life decisions with confidence, be able to weigh options rationally, and improve your relationships at work, at home, and beyond. High stress levels can also have a direct impact on your menstrual cycle, causing you to stop having a period or even to have your periods too often, which can affect your ability to get pregnant. Establishing good stress relief outlets now will help you during pregnancy and in the hectic first year of your baby's life, because all you need is a healthy baby. Try yoga. Yoga has a number of benefits for your fertility. Taking on regular yoga practice may help with your emotions and anxiety related to the conception process. You'll also strengthen and stretch your body in preparation for pregnancy. It reduces stress and anxiety and increases the strength, flexibility, and endurance of muscles needed for childbirth. It helps in decreasing lower back pain, nausea, headaches, and shortness of breath. So you must try yoga out to have a healthy life and baby both. Visit the dentist. While you're getting all your checkups, it's best to stop in to have your teeth looked at too. During pregnancy, the hormones in your body may affect your gums and teeth. Good brushing habits before pregnancy can help ward off pregnancy gingivitis and cavities. Brush your teeth with fluoride twice a day and floss once a day. Use a toothbrush with soft bristles. Regular brushing and flossing can remove plaque and help keep your teeth and gum healthy. That's the way how you can keep your oral hygiene. Quit tobacco, alcohol, and drugs. Smoking, using drugs, and drinking alcohol can harm an unborn baby in a number of ways. Smoking exposes your baby to harmful chemicals, restricts blood flow, and may even cause preterm labor. Smoking is a known risk factor for infertility. Our lung cells are separated from the blood vessels in the lungs by just one cell layer. So anything we take in, such as cigarettes or marijuana, goes into the bloodstream and transits throughout the body. Drinking puts a baby at risk of fetal alcohol syndrome. Using drugs, such as heroin, cocaine, methamphetamines, marijuana, etc., may cause birth defects, miscarriage, or stillbirth. It is better never to start smoking at all. But if you are currently in the habit of lighting up, try quitting smoking to boost your chances of a healthy pregnancy. Have sex. Resist turning sex into a chore from the start. Have it often and for fun. Be spontaneous and passionate. After all, sex is what will likely get you pregnant. Creating sound lovemaking habits now will help strengthen your relationship. If you don't have any known fertility issues, don't worry about timing sex at first. Instead, have frequent unprotected sex throughout your cycle. Reach your healthy weight. Do you know your body mass index, BMI? Your doctor will probably calculate this number at your physical. If your BMI falls into the overweight or obese categories, Talk to your doctor about healthy strategies for losing weight. If your BMI is in the underweight category, you should also talk with your doctor. Your weight can impact your ability to conceive, so talk to your doctor or dietitian to learn about proper calorie intake, exercise, and other healthy habits as you try to conceive. Some people are underweight, especially those with eating disorders, like anorexia or bulimia. They may not ovulate or may have irregular periods. Even those who are underweight without eating disorders can have issues that relate to ovulation, cycle management, implantation of pregnancy, and preterm delivery once they do become pregnant. Obesity can, too, affect your menstrual cycle, including the quality of your eggs. And people who are overweight are at high risk for miscarriage, chronic hypertension, gestational diabetes, and preeclampsia. Gather family medical history. Your baby's health will also be influenced by genetic factors that have roots in your family tree. Before you get pregnant, you may want to ask your parents or other relatives if there are any genetic conditions that run in your family. The same goes for your partner. Your family's health issues can be your health issues, or at least play a part in the way your doctor addresses your questions about fertility. If you know you have a family history with your mother, sister, aunt, or grandmother, this information is critical to share with your physician. Having this information will help your daughter make more informed decisions about certain screenings, diagnostic tests, and other procedures to help mitigate or minimize complications in getting or being pregnant. Discuss prescriptions. Make sure your doctor knows that you're trying to conceive so they can take a look at your prescriptions, medications, or any other supplements you might be taking. Some of these medicines may not be safe during pregnancy. Get good sleep. Sleep should never be seen as a luxury. It is a necessity, especially when you're pregnant. Many parents worry about sleep in the days after they bring home their bundle of joy. But sleep during pregnancy can be just as elusive. The amount of sleep you get while you're pregnant not only affects you and your baby, but could impact your labor and delivery as well. When you become pregnant, one symptom you may notice is being overwhelmingly tired, even exhausted. So make sure you get 8 to 10 hours of quality sleep when you plan to conceive a pregnancy. Limit caffeine. Do you drink a lot of coffee or other caffeinated beverages? Daily intake recommendations for pregnant women are only about 12 ounces of coffee per day. Try slowly weaning off if you're currently consuming more than this amount. You don't have to give up on your morning coffee when you're trying to get pregnant, but if you typically have a few morning mugs, you might want to cut them down. Having more than 500 milligrams of caffeine per day, the equivalent of 5 or 6 cups of coffee, has been shown to have an impact on fertility and miscarriage. Again, be careful and do not take more than 2 caffeinated beverages per day. Guzzle water. A whopping 60% of your body is made up of water. Keep yourself hydrated for optimal health. Women should drink 8 to 12 cups of water each day. When you become pregnant, you may want to increase this amount. It aids digestion and helps form the amniotic fluid around the fetus. Water also helps nutrients circulate in the body and help waste leave the body. That's why doctors always suggest having plenty of water intake during pregnancy. Have him get checked out. Though much of a healthy pregnancy has to do with the woman, it's a good idea for your guy to get checked out too. Around 30% of infertility cases can be traced back to male factors. Make sure he schedules a physical, eats well, exercises, stops smoking and taking other drugs, limits alcohol. Boost your immune system. During pregnancy, you're more susceptible to colds, flus, and other illnesses. Give your immune system some extra help by eating a healthy diet rich in antioxidants, getting vitamin C, and resting. Some great supplements to help your immune system during pregnancy are zinc and vitamin D. And beyond food and supplements, one of the best ways you can strengthen your immune system is a good night's rest, regular exercise, and reducing stress. Your mindset also plays a huge role in your health and the health of the baby. Work around. Your job may be physically demanding or require some dangerous moves, but heavy lifting, Standing for long periods of time and bending at the waist may lead to menstrual disorders, fertility issues, or miscarriage. Discuss your concerns and the recommendations for lifting with your doctor. When you do become pregnant, you may want to avoid lifting heavy objects from the floor, lifting overhead, and repeatedly bending or stooping over. Communicate. You may conceive in your few first cycles of trying, but it often takes couples much longer to see a positive sign. Before you start trying to conceive, make sure you're being open and honest with your partner. Talking about any issues or frustrations you have on your road to baby is the key to keeping your relationship healthy. It can be frustrating and even devastating to try to conceive and continue seeing just one line on repeated pregnancy tests. If you've been trying for 6 months to a year with no success, it may be time to see a doctor. Infertility is defined as 1 year of unprotected intercourse without achieving pregnancy. If your age is 35 or older, though, that time frame is shortened to 6 months. Start having a dialogue with your partner and your healthcare provider sooner rather than later, so you can feel prepared and assertive in starting to get the care you need. The takeaway: there's a lot to think about when you want to add a baby to your family, but with a little preparation, you'll be on your way to a healthy pregnancy. That's all about the guide to preparing your body for pregnancy. Hope you enjoyed and found the content according to your need. If you obey the steps and follow accordingly, very soon a flower will blossom in your lap, and that is the sweetest and most blessing moment. If you have any questions, do write us in the comment section below. Even share your own experiences with us. Do not forget to hit the like, comment, and share this video. We'll see you in the next video with other amazing content. Until then, take care of yourself. Best wishes to you. Thank you.